see a couple of other people, but this is a little handout that I made for the people that are wait in the waiting room, a little bit more about it. So before we start, what have you heard about it, Shockwave? And I'm sure most people here for soft tissue injury problems, and that's plagued my office for 25 years. Me and my dad, we run a chiropractic office, but we see a lot of injuries, sciatica, we see a lot of sports injuries, ligament problems, sprained ankles, jumper's knee, we see frozen shoulders and bursitis, we see hip bursitis, and we take x-rays and we look at the hips and we see a lot of bursitis, wearing thin of the bursa, as well as bone spurs in the hips, which leads to IT band problems and eventually comes into the knee. People start to get knee problems when they have hip problems. The kneecap rotates. Now you get the meniscus starts to move a little bit and get wobbly. What causes most soft tissue injuries is not tightening, it's loosening. The ligaments and tendons are like rubber bands. They have to be elastic and they lose their collagen and elasticity as you get older, and they've been worn out and they move around too much. So a knee that, just like a disc problem that people wear out, that's too loose in that joint. That joint's not stabilized and then things move around. People think it's too tight. The joint is too loose originally, but what ends up happening is that it gets too loose, the body tightens the muscles around it to protect it, and now you get spasms in your back. That's any joint.
So does it work on people who have bone spurs?
Yes. It doesn't. From when they explained to me, not only does it work on people who have bone spurs, but right here, is it possible to communicate with biological tissues? They're calling it right here. So these are right here are some pictures that there was a fracture right up here, and then afterward you see that filled in. They have the date of injury 3 months later. Mechanotransduction. Is it possible to communicate with biological tissue? So what this does is when that sound wave goes in, the doctors there said they're not even exactly sure exactly how it works, but they know. Hello. They know that when these sound waves go in, they expand and contract the cell membranes. So we know that the cellular function is very important for tissue to heal. It breaks up collagen, scar tissue. It allows the nutrients in and the toxins out, because that's what the cell membranes do. They think it stimulates the mitochondria to release ATP to start healing areas, and they have seen cartilage growth, bone growth afterward. As far as bone spur decrease, I'm not sure about that, but they've also seen that receptors in organs and cells, this mechanotransduction, they've seen it go through all kinds of tissues. And where I was up here before, even communication control group and EST, they did kidney beans. They put them on. These were the group that they did the it opened up.
So it's more to stimulate the cells and increase.
That's what they think the mechanism is.
Okay.
They thought at first it was just vibrations that broke up things, but now they're finding that it almost acts like fertilizer where the things start growing back.
So how's it different than ultrasound? Because ultrasound versus shockwave.
Yes, ultrasound and shockwave. So ultrasound is like a positive negative charge that bounces off of things.
Okay.
A shockwave is like a plane that flies by and it's going fast in the speed of sound, and you hear that shock. It's like 5 times the barometric, 10 times the barometric pressure. So it builds up a charge.
Yep.
It shocks it, boom, it comes out, and you can adjust the intensity as well as the frequency of how much these shockwaves come out.
Okay.
So you can hear this is at a higher setting, and we go down to 1 hertz.
Okay.
It's like 1 hertz. It's like every second. It's
Okay.
2, 3, 4, 5, up to 6, and then you can go up to 55 as the maximum amount.
How painful is that?
Well, here's the thing. It's uncomfortable, but when you hit the right tissue.
Yeah.
I had a guy, I can tell you, I've had 40 plus people already, and I got this in September, and I didn't do any of these meetings because I was not prepared for the volume of people. I have hired some people to help me with this now, and what I wanted to do is I wanted to see how it works for myself, because I went to my friend, who's an orthopedic doctor at Hawthorne, and I work out with some of these guys, and I said, hey, have you heard anything, what's good? Because I see all kinds of things. Bone growth stimulators, you see these red light therapies, you see electric stim, all these modalities. I've seen them all in my office. I have some of them. I have arthro stim. I have a muscle, it's called an RRT, a rapid release technology. It's a muscle stimulator that tries to break up scar tissue. It's the big problem. Like, why? The biggest question people ask me is, I get adjusted this day, how come I'm back out of alignment by Thursday or Friday? How come my adjustment doesn't hold? Because a lot of these tissues, they don't hold the alignment. And a lot of these injuries are chronic inflammation problems that have gotten out of control, partially because of lifestyle and diet. So this is not a cure-all. This is not, oh, I'm gonna fix everything with this machine. The emphasis of these scientists, what it is it was multi-dimensional. And let's go to the slideshow here. We'll start again. So discover the power of Shockwave Therapy, hosted by me, Brian Polochick. Welcome to the webinar. Overviews of the session. We're going to go over the benefits of Shockwave Therapy, the conditions it treats, some of the contradictions, and just what it costs to come here. So what is it? It's a high energy sound waves targeting an affected area. Promotes healing and pain relief. Non-invasive drug-free treatment option. These were going through kidneys to go into the kidney stones and break them up. But then they found out that these people's hip flexors were feeling a lot better because those start up here, those iliopsoas, and they go to the front of your hips that allow you to lift them up. Me and my dad was a disc specialist in this office, and how many problems with low back chronic problems? He always said it's the pelvis and T12, which is where those iliopsoas muscles attach to. They attach to the sides of the vertebra. They torque the vertebra, the disc slips out, and when they go in there and do L5, guess what happens? Within 3 to 4 years, L4 is going, or below or above it, and it goes right up the chain. Fusions happen, we see them repeat surgeries constantly. So you're talking to someone who's been around for 27 years. My father was around for 50 plus years. Owen Melody, his old boss, 65, 70 years of experience. These guys were experts at disc problems, very soft, specific chiropractic adjustments. And so I've learned a lot over the time, but you run into problems in practice. You run into chronic injury problems of shoulders and elbows and knees and hips, and there's got to be better ways. So when I asked my friend, he said, hey, this is it's not a new thing, but they're using it for new stuff. It's an older device. It's been around for 10, 15, 20 years. It's just that they never used it for soft tissue so much. And in Europe, they do. You know that in Europe, in Germany, if you don't offer this before and after surgery, hip replacement, knee replacement, they will sue you, and they have the capacity to do that. Because the guy said the results are so much better with this before and after surgeries than not getting it, that they could sue the doctor there. These guys were all German scientists. They're way ahead of everything. I mean, they're doing all kinds of stuff that I can't do. They're doing open heart surgeries and they're putting that on for AFib. They're breaking up plaque in the brain for Alzheimer's and Parkinson's, which is type 3 diabetes if you want to get technical about it. So there's all kinds of applications. I bought it for shoulders, knees, elbows, hips, and whatnot. But they're the guys I call randomly, because they send, when you're looking for the right machine, everyone knows somebody who says, go here, and they get the $500 gift card if they sell you that unit. So I called random people that were separate. And I like one guy, Pennsylvania, how you doing? Well, good. I have my office here. I've opened 2 fertility clinics because we go over the uterus and we're finding that it breaks up fibroids and impurities, and next thing you know, people are having kids. Crazy. He hired urologists and OBGYN doctors to work for him and opened up a clinic doing that. So hair growth of people that have 3rd-degree burns, people that have dropped stuff on their toes and had to have their toes most likely amputated. I was sitting next to a couple podiatrists. I won't show you the pictures, it was not pretty, but they show a timeline every 2 weeks of they were doing this, growing back nail, growing back the toe, healing fractures, even non-union fractures 5 to 10 years out. I have one guy in here who had a bulging fracture playing pickleball on the side of his fibula, and he's had it for a while. He couldn't run. He couldn't play pickleball anymore. Now this guy was more like, to be honest, 12 visits he's had so far. He had the money to pay, and he really didn't want to have surgery. He went up to his doctor, and his bone started to grow back in, and no screws.
So it stimulates the tissue and the cells and like regrowth kind of.
Yes, it thinks that it deals with the collagen membranes. It helps to rebuild back, but it also stimulates the mitochondria to make more energy. Nerve cells. I've had 2 Morton's neuroma in the feet. That's not on the list of things, but somebody said, hey, I'm willing to try it. They're feeling less numbness in that area. I've had 2 Baker cysts. I've had several frozen shoulders, several elbow, carpal tunnel problems, even a girl's finger that she got caught in the door with 30 stitches around it. And we were working around it because she's got to heal a fracture. This thing's supposed to go faster and heal things faster. So there's no downtime. It's non-invasive, drug-free. Promotes stem cell migration to clean up the scar tissue. So it's doing micro trauma, and now the immune system comes in and tries to clean up the mess. So it doesn't make stem cells. Be clear of that. When you do micro trauma to tissue, what happens is the body tries to clean it up with stem cells afterwards. So it invites in the stem cells afterward, which of course speeds up acceleration. And there's biofeedback. There is discomfort where there is scar tissue. You don't have to guess anymore. I've seen so many frozen shoulders. I had a girl who had 2 double bone-on-bone shoulders. She is 83. She's too ill to get surgery and replacements, and she's too old. She wanted some relief. I have the video of her coming in, like she barely go like this, and afterwards she's doing this after 1 visit. She's got another appointment this week. I've seen so many different things happen to people that were, not explainable in the normal terms, but there is discomfort where there's scar tissue. What I'm finding is that people come in with frozen shoulders. I'm doing where the rotator attaches to, nothing. I come down to the bicep tendon, next thing you know, that's where they're hurting.
Because of the insertion and the origin.
Well, wherever's causing the bicep attaches up in the shoulder, a lot of times it's pulling that up here. Or it's the teres minor under here or under the arm, because this thing goes out about this far, and each head you put on it. So it shows there's a quick reference guide on here, and it shows you, like, if you took this front off and just had the membrane, like right there, that goes out the furthest, and the sweet spot's about this far, so that could go into deep into shoulders, hips. If you put the standoff one on, which is a rubber tip on this one, now the sweet spot, instead of out here, it's like right about here.
How far does it radiate? Just the circumference
Well,
of the...
this is a focused shockwave. It
Okay.
radiates a bit, but it's for focused attention, meaning you roll over, you put the gel on, and you start exploring around.
Okay.
And now what happens is you start to feel it at different angles. Like sometimes I have to put people's arms up like this. I bring it around like this. I'm coming around in the rotators, and you find the spot. Next thing you know, you can feel it. And I would say it starts off, the settings go on microjoules, which is a measurement of energy units called joules, and then microjoules. And it starts off at 0.01, which is hardly recognizable. You started off. Some people even feel that. It's like a 1, or it feels like this weird pressure. You gotta experience it to understand it. It doesn't feel like anything I've never had. You can go up, and what you do is you wanna be around a 5 or a 6, and so feedback with the patient is important. You tell me how it feels. Oh, I don't feel nothing there, I don't feel, you touch the spot, you can feel it. Like I had a guy with sciatica, he had a disc problem down here, I'm all in through here, nothing. I go to the SI joint, starts feeling a little bit. I come down to where the piriformis and the sciatic notches, where the sciatic nerve comes out, that's where it was. And I think it was a piriformis syndrome where there was damage on the piriformis, tightening the sciatic nerve, and it wasn't coming from his low back disc problem, it was coming from his muscle that was tightening the sciatic nerve going down the leg. Same thing with hip flexors. The femur head, the femoral nerves go down the front of the legs, they come right through the hip flexors. If those are tight, they jam up those nerves. A lot of times neuropathy and the tingling in the fingers is from the shoulders that are too swollen. All kinds of applications of this. Neuropathy, people have seen that improve. Like I said, the jumper's knee,
the hip flexors, tendinitis, bursitis, ligamentitis. And it does give you feedback, so you feel it. So it's a non-invasive treatment that uses high energy shockwaves to help repair tendons. It can also help with soft tissue injuries such as ligaments. It delivers shock waves to the injured area, stimulates the body's natural healing process, increases blood flow and cell permeability. This thing does angiogenesis. It's like, so it stimulates the production of red blood cells, which is what helps our body heal. It also stimulates blood flow and it reduces inflammation. I think it stimulates the mitochondria, which are those energy centers in the cell that make energy. When they make ATP and more energy, that's what red light therapy does. It stimulates the mitochondria. And the deeper it goes in, the problem with most treatments, they don't go deep enough. You can't get inside that femur head to stimulate the growth of that tissue in there, or inside the shoulder that's deep inside. This thing goes deeper. Some of the contradictions, you can't go over lungs. So you don't want to go over here or over the lungs and the thoracic from about here to here. You want to stay away from cavitations like that. If you have an infection there, if you have cancer, because it stimulates bone growth. So you don't want to have, if you have malignancy or cancer, that's another contradiction. And if you're on blood thinners, or if you've had too many cortisone shots in a row in one particular area. What contradictions they used to have is kids under 18 couldn't get it. These guys said, not a problem. We've seen no problem with growth plates. It used to be, nope, and if you're pregnant, you can't get it either. So at least 3 out of 4, 3 out of 5 can't get this. So they release growth factors and healing cells, and they create a controlled inflammatory response, C-reactive protein, all these things that we, I understand, but so it's not just mechanical, it's biological. Mechanotransduction is communication with biological tissue. If I come over to here, it was talking about biological tissues, control group of kidney beads, even orange dots, active mitochondria in the nerve cells, before and after. Look at the difference of the mitochondria. The nerves come back to life. That's what a lot of people have nerve damage. This is rejuvenating the nerves, the cells, the blood flow, and all the membranes, which allow circulation and blood flow and nutrients. The cell membranes in the cells, to let you know, the omega-3s, 6s, and 9s are around the membranes, and 3s allow nutrients into the cells, 9s allow them out. Too much fried food, what happens? You get too many 6s on there, you can't get nutrients in and out. Now people start to have inflammation problems.
Do they use it with any kind of spinal cord injuries or any kind of
They're using it for all kinds of
amputations
stuff.
Okay.
Now, depending on your jurisdiction and where you are, you can't say that you're healing people of these things. You're saying that you're trying to make people healthier. You're not treating, just like chiropractic, you gotta be careful. We don't treat this, and this. Just like when people come in here and say, I got migraine headaches, I got lupus, I've got, autoimmune problems, I've got Crohn's disease, I've got autism, I see a lot of ADHD. We don't treat that. I make people healthy. Healthy people heal, sick people don't. That's the philosophical difference. Is medicine tries to diagnose and treat symptoms, but they never figure out why you got your problem, and they never cure your problem. There's no money in cures. You manage people, and I guess they do their best, but it's a different philosophy of how you fix things. And my background is, how I got into this is I called my friend from Hawthorne, and he told me to go look into this kind of unit. I talked to a bunch of people. I found myself in Hopkinton on a Saturday with a guy who's a chiropractor who does all the Celtics and the Bruins. He has this unit. He says, Brian, all the PTs in my neighborhood hate me because I'm fixing people way quicker and for less money overall, less time. So I said, well, I had a torn meniscus a year and a half ago from a trampoline injury, showing off to my kids that I could still high jump. And it had killed for a year and a half. I couldn't bend my knee like this when I come down. Basketball, I limped through stuff, but it was tough to even get on my knees. I went up there in one treatment, and I walked out of there, and I could definitely walk in the parking lot and say, that was way different than I have in a year and a half. I've had other colleagues, MDs, and other fellow chiros that have come here and gotten some of this, and they notice an immediate difference afterward. Even people who have bone-on-bone degeneration, even people with ligament tendon problems. Rips and tears, you're not going to fix. If it's torn, ripped in half, you're not going to fix that. But there's some people that have torn ACLs that don't have a lot of pain, or they have pain, but it's not from the torn ACL. It's because the tissue in there is damaged. So you can't repair an ACL with this, but you can stimulate the tissues to grow back, and the soft tissue and the connective tissue in there. I mean, for a lot of people, fascia. Fascia is the key. If you hear plantar fasciitis, fascia is the mesh in our body that holds all the organs and things together so your heart doesn't end up down in here. Well, it holds everything together. As we get older, that tissue gets damaged from trauma, from poor diet, from lack of exercise, from getting old and less blood flow, and then we're on blood thinners, we have less oxygen to our tissues. People have sleep apnea, all these, I mean, I'm in the health industry. I know these things and I can speak to them fluently, whereas some other people cannot. But these are things that start to happen. So, benefits: it can relieve pain, can help with chronic injuries, can help with difficult to heal injuries, can help with injuries that have lasted a long time, and they help injuries that have calcium buildup. The body's not stupid. It tries to repair things with calcium. But calcium's not flexible. Magnesium and potassium is what makes soft tissue soft. The body tries to calcify it to protect it, to build it stronger, but now it's not flexible. What happens? Now you have no flexibility. I have, let's see if I have it right here, recent Google Drive right here. Well, this girl, let's see if this shows up. This was a downloaded video. And this was a girl who had a frozen shoulder on the right side. She came in here and she could barely move like this. And when she was done, she's had, I think, 2 or 3, and she's moving around like this. It's taking a little bit longer than I thought. I'll show you the video after it on my phone if I need to. Let's see if it shows up. So when it's used, Shockwave can be used to treat tendinopathy, ligament injuries, and therapy can be used to promote healing after surgery. A lot of scar tissue on fusions in the low back, meniscus, shoulder surgery, rotators, the scar tissue, that's why it still hurts. Doesn't always mean that the surgery wasn't effective. And the stores, state-of-the-art technology. I called several people, they said this is the best around. And when I went up to Boston just 2 weeks ago, that's what these guys were talking about. They're from the International Society of Shockwave Therapy, and they've formed an American Society of Medical Shockwave Therapy. And again, I'm sitting next to a table with guys that have been using this for 5 years, and they're like, you'll be mind blown. I said, I've already done about 30, 40 people in my office in 3 months, and I've seen enough to know that there's no doubt that this thing works. Adjustable intensity and depth for tailored care. It's an electromagnetic shockwave. There's different units. There's electrohydraulic, which is like a water-based electrode. The guy told me some people like it, some people that they don't last as long, and they have, what happens in the beginning, the shockwaves are strong, and as it goes along, they become weaker. The guy told me that an electromagnetic, which is a newer technology, every wave out of this is the same until the thing dies. And you can get like 1 million to 2 million clicks out of this. Theirs are 500,000 or even 250,000 some people. So it was much less. Trusted by healthcare professionals worldwide. And that's me doing the guy's ankle that had an avulsion fracture right down in here. And I started, I used my chiropractic skill. I was using the gun to try to push the bone closer and do a little toggle on it. And then was working on it. Benefits: accelerates tissue healing, reduces pain and inflammation, enhances mobility and circulation, expands and contracts collagen cell membranes and breaks up scar tissue, gets to deeper areas, and is suitable for chronic or acute problems. And new blood can help reduce and eliminate medication, very little side effects, accelerates tissue healing, and we already went over some of that. Conditions treated: plantar fasciitis, Achilles tendinopathy, ligaments in the ankles and knees, tennis elbow, golfer's elbow, rotator cuff frozen, bursitis, low back disc, hip sciatica, calcific tendonitis, knee, ankle, foot, even digits, trigger fingers. These guys are fixing a lot of the trigger fingers, breaking it up. Except they cheat sometimes, these MDs. They put people under anesthesia. crack it, break it open, and then use the shockwave over it to break it up. And you see a lot of black and blue, but it breaks up those tendons, ligaments, and it softens that tissue. Trigger points, muscle tightness, and more. Back and neck pain, whiplash, bone fractures, including non-union, hip joint pain, jumper's knee, IT band, carpal tunnel, TMJ, surgical preparation and recovery, can go over hip, knee, shoulder replacements due to sound, non-electric, accelerates healing, we already talked about that. They're not exactly sure what's happening, but it helps reduce healing time dramatically, sometimes twice as fast. And avoid it. If you're pregnant, have a pacemaker. If you have an electrical stimulator, you want to mess with that kind of stuff. Blood clotting disorder, a malignancy in the area, or an active infection. And then what we do is, my biggest challenge in here was that finding out how many visits somebody needed. It's not a cheap therapy. It's equivalent if you did it, the time consumption and the co-pays of 8 weeks of physical therapy. Sometimes this can get more results in 3 or 4 sessions at once a week than that kind of stuff. So I had trouble. It was $175 a la carte of a treatment, and then I was doing 3 for 500, 6 for 900, and 10 for 1400. But I was having a hard time telling. So what I did is I did one visit is about the average of my office visit, $70. You can see if you like it. It's not going to break the wallet at that point, at that cost. And if you don't feel anything, maybe there's no scar tissue, maybe there's nothing you can do. You get a taste of it and see if you like it, and then you can go from there and see if it's something that you would want to pursue. And then what we do is we can either do three at a time, or some people that are really just more chronic and know they're going to need a little bit more because they have worse problems. How fast, how many you need, how fast you heal, again, determines your health. You know, people keep getting soft tissue injuries. That means they're not healthy. They're not eating enough fruits and vegetables. They're eating too much processed foods and pasta and wheat. Insulin resistance or type 2 diabetes and pre-diabetes is a huge problem to soft tissue and inflammation. So people need to work a gut-friendly lifestyle, anti-inflammatory like diet. They need to manage their stress. If you do yoga and Pilates and you stretch more, you're going to heal faster. If you exercise and drink enough water and start putting pH drops and apple cider vinegar in all your food and get more minerals into your joints, your tissue's going to heal faster. I mean, this is not what this was about, but I always throw that in because it's like one modality doesn't cure everything. You need to take the multiple approaches: stretching, getting a good night's sleep, drinking enough water. But you need to start to break some of these chronic problems up. That's what this machine does. And that's what those cost. What I will do now, open the floor for questions. This was with my online version. So I am done with that. I could take any questions, and then after, if we answer all the questions, I will, if someone doesn't have any of those contradiction problems, we could do a little sample and show you what it feels like on a wrist or a shoulder, and you could take a feel of what it feels like, because I would be happy to do that. So I'm going to shut this off here for Q&A.